Okay. Hi guys. So this is my presentation on the procedure is collection of skin and body fluids specimens. So when is it appropriate to collect skin or body fluid specimens? So the main reason we do this in practice is to provide microbiotic evaluation of pathogens. The results from this collection will help further diagnosis and treatment plan for the pediatric providers. As the PDNP practicing in primary care, here's the list of some specimens you may want to collect depending on your evaluation of the clinical data in terms of the patient presenting with certain signs and symptoms, or maybe in the case of an asymptomatic patient. So it's blood, urine, CSF fluid, which I think would probably be done in the hospital if that happened, vaginal fluid, skin, sputum, upper respiratory fluids, penile discharge, and then stool. Okay, so some age-related considerations. So for infants, you want to offer them objects that are familiar to them so that you make them feel comfortable doing the procedure. You want to limit the number of strangers in the room because that will be helpful to make them feel like they're safe. For toddlers, you want to make sure you tell them what they're doing right before you do the procedure because they change how quickly they're going to do something from time to time. So you want to tell them and then do it right away so that they're not scared. Preschoolers, they use a lot of magical thinking. So you want to use interactive play with the collection of the specimen. For school age, you want to allow them a lot of independence because they want to participate. So getting them to participate in the specimen collection, as long as it's safe and effective, you can definitely do that. And then with adolescents, you want to educate them on why, when, and how you're collecting it. And you want to make sure you have consent with them and with all the patients, but especially with the teenagers. Okay, so there are a lot of methods for completion of this procedure because there's all different types of specimens that you would collect. So for upper respiratory, you're going to take a nasal swab and you want it to be moistened and you're going to go bilaterally in the nares. And then you want to do both of that with the nasopharynx and you're going to put it into a sterile medium. And then the throat, you're going to do the same thing. You're going to swab into the posterior pharynx or on the tonsils, depending on what you want to get. For lower respiratory, you want them to spit their sputum in a cup. If it's sputum, you want to have the patient rinse their mouth, and then you want to use a gram stain for that. For the bronchoscopy fluid, it should be a sterile container. For stool, you want to send their stool in that big, like wide mouth cup that's sterile. If it's C. diff, it's the best choice. You want to send that off if the patient's had diarrhea, especially if it's been post 3 days from the hospital. The ova and parasite, you want to make sure you tell the laboratory technologist that they want to look at it right away in case they see something. And then if you want to do blood, you want to rule out bacteremia. You want to make sure you get 1 to 5 milliliters in the specimen. For fungi, this is when you would detect yeast, and you want to process that within 8 hours of collecting the specimen. Cerebral fluid, so this would really be done in the hospital, so I'm not going to go over that. Okay. Endometrial or pelvic, you would use a sterile anaerobe container, and you can get 1 to 10 milliliters to send. Chlamydia and gonorrhea, it's the swab specific to that. The HSV is another viral swab, and you want to transport it in the medium. And then the vaginal swab, again, is just in the vagina, but that rules out for trichomonas. So for tissue, like if there's an abscess, you want to transport it in a sterile container, and then, which I didn't know, you want to keep the specimen moist with sterile gauze. And then you want to try to get as much of that tissue or pus as possible for colonization because you'll have better results to see what bacteria is causing that. And then urine. We do probably a lot of urinalysis in primary care. So you want to have them wipe with the antiseptic wipe and then do a clean catch of at least 20 milliliters of urine. If the child is too young, you can have the parent assist with that. And then if you have an infant who comes in with suspicion of UTI, the PDNP, you can do a sterile cath, and then you can get that specimen by straight cath, and that will be a sterile specimen because you can't collect it from a diaper from an infant without it being not sterile. Okay, so what are the expected outcomes and follow-up? So the provider should expect an accurate and timely results of the specimen set to be evaluated by the microbiologist or the lab techs. With this information, the provider will make proper diagnosis and treatment plan for the patients with expected resolved disease state. Um, if a virus is detected, in most cases, this will be self-limiting illness, and the provider would not prescribe any treatment, but usually comfort care. You do want to educate the patient about what to do if the symptoms get worse or if a fever occurs. And if it was a bacteria, then you would use the antibiotic that would have the best coverage for that bacteria that was found on the culture. Okay, so some billing and coding considerations. So according to the AAPC, these are the following relevant codes for specimen collection. So 8100 to 8300 is urinalysis. 36416 is venipuncture. So if you were going to do a lab draw, like if someone's going to draw the blood in house, and then also 99000, that is just like a broad code for preparation of specimens. So like any specimen that you wanted to collect in office. And that's what I found. Okay. And then some clinical practice guidelines that were from UpToDate. So these are ways that you can ensure that the tissue or specimen collection, that it's safe and that it's accurate and that we get the best evaluation of these specimens. So obviously the provider should wash their hands before and after. You should be wearing appropriate PPE if that's, goggle, like shield, always wearing gloves. And then you want to make sure you know ahead of time how much fluid or tissue you need to gather, because there's specific, like we saw for methods, there's specific amounts that you need in order for the lab to process it. So sometimes they won't process it if you don't give them enough or if you give them too less. And then you'd have to do it again, which is horrible. And then you want to make sure you label every specimen. You're going to look with the label and against an MRN with the patient to ensure that it's the right patient that you're collecting the specimen on. And then lastly, you want to make sure that you set up timely collection and processing of the specimens. Either if you have, the patient go to a laboratory outpatient that then takes the specimen and then they do the lab work there, or if you have a courier coming to pick it up, because some of these tests they're temperature specific and they're also time specific. So you want to make sure the pathogens get to the right place in the right hands in order to get effective results. And then these are my references, and that's it. Thank you.